Television Network, TSPN. And now back to Today's Seniors Living Well with your host, Laurie Webb.
Hi everyone, welcome back to Today's Seniors Living Well. Our theme in this sixth series has been aging well shouldn't be a puzzle, but there's a lot of puzzling things that happen to us as we age. And we've been focusing today on some preventative things with respect to dental care and fraud. We just talked to a wonderful senior, Thelma Clancy, who's 94. She's managed to age pretty well and not be too puzzled by it. But one of the big fears that most of us who are older have is not so much anymore the fear of cancer, but the fear of stroke. Most of my senior friends don't want to have a stroke. So today joining us we have Dr. Van Fossen, who's our local neurologist, and Tamara Harding, my old nursing buddy. So the hospital has taken a very proactive stance on the whole stroke situation because we're seeing more strokes, or what's going on with that?
Well, strokes are very prevalent. I don't know that the number of strokes are going up, but our ability to deal with them is improving. So that's why we're here today. We want to get the message out that it's important to get in quickly if you think you're having a stroke.
And stroke symptoms are kind of elusive sometimes.
They can be, but most of them are pretty clear-cut. Speech, a sudden change in speech, a sudden change in ability to move an arm or a leg, or sudden numbness on one side of the body, or sudden inability to balance. All those could be symptoms of a stroke. In fact, anything that happens suddenly just like that could be a stroke. And it's better to ask and get help.
Err on the side of caution.
Exactly.
Yeah. So there's a stroke protocol now in the emergency room, I understand. So let's say somebody gets there quickly, and what happens when they show up at the emergency room?
You're exactly right, Laurie. We've developed a great program, and the patient comes into the emergency department. They call it stroke alert, and we talk about it as a swarm. The staff swarms the patient, and we get them to the CAT scanner as soon as possible, because what we're looking for is they're going to be anything showing, particularly a bleed, because we don't want to give that magic clot buster to somebody who's bleeding, because it'll only make it worse. So if we get them there quickly, then we can get them back to the emergency department, and the emergency physician can talk with Dr. Van Fossen, and we can get that clot buster administered to that patient.
If there's
a clot.
Yeah.
But you can't see that on the CAT scan. So what you'll see on the CAT scan is a bleed that'll stop us.
Oh, I see.
So then that magic will happen. In fact, yesterday we had our stroke survey for our primary stroke center, and we were recertified, and we discussed a case of a patient who went over to Sutter Roseville Rehab, and she'd gotten a clot buster and was singing our praises because she was disabled, already a little bit disabled, only a 50-year-old person, and she now has this opportunity. She said we saved her life, so it's wonderful. So I don't know, I brought these magnets with me because the new mnemonic for being able to talk about stroke and getting quick help is using the mnemonic FAST. So FAST stands for, F is for face, any droop or any speech changes. A stands for arm, but we're really talking about limbs. So if you get any any weakness or you can't move it, that's what that's about. S stands for speech, and T stands for time, because time is brain with a stroke, just like time is a problem when you're having a heart attack. You want to get something done right away. So for a stroke, we want you to get right to the emergency department. Stroke is an emergency, so you need to call 911 if you're out in the community, and you need to, if you're somewhere close to the hospital, get there quickly, because we'll be able to work and take care of you.
It's important to realize that as far as the time, we have a small time window to work with. Really about 3 hours between the time that you actually have onset of symptoms to the time that we can safely give the medication is 3 hours. In some cases, we can extend that out a little bit further. But really, the longer you wait, the less ability it is for the medicine to work as well as it can. Ideally, if we could get to you in 30 minutes to an hour, that's where you're going to have the best results.
The best results, right. And, that's, although the symptoms are, pretty clear and pretty dramatic if you've ever seen somebody actually have a stroke, I know that a lot of the baby boomers, particularly the males, are a little reluctant to acknowledge symptoms sometimes. So, they're like, oh, yeah, my arm's feeling a little. And I think we really have to encourage people to take those symptoms seriously, because we have seen a lot of younger people with very serious strokes in this county. And I just wonder if some of them had been ignoring previous symptoms. And
It's very possible. A lot of times people will tell me that they waited a day or two just to make sure that it was a stroke, and they weren't coming to the emergency room for no good reason.
No good reason.
So,
yeah. And when someone goes to the emergency room with stroke-like symptoms, they're treated very seriously. I mean, it's not like, oh, well, you're probably just tired. It's really people
Right.
jump on it.
Right.
I know that Jim Geedy from the radio station, right after the stroke program was implemented, he had some symptoms that turned out not to be a stroke, but he was amazed at the swarm that
Right,
happened.
right,
Yeah.
right.
So.
Yeah.
So what are the some of the things that could possibly, I mean, we know a few things, like I know I have to control my high blood pressure because that's a risk factor, but what other risk factors are there?
well, the big ones are high blood pressure, smoking. Smoking's a
Stop
really big one.
smoking.
Smoking.
It's not just hard on the lungs. It's very hard on the arteries, both the heart and the brain. That's one of the biggest of the risk factors. Diabetes is a risk factor. Try to keep that under control. If you haven't been tested for that, you should. Those are our big three.
big three,
And of course, then the smaller ones, everybody thinks cholesterol is real important, and it has importance. But as things go, smoking and high blood pressure up here, cholesterol's down here. If anything, I'd want to take care of the high blood pressure and the smoking.
And
Those are
if
the
you
big
quit
ones.
smoking, sometimes that helps with your high blood pressure. But those of us who
right.
were not smokers need to control our high blood pressure too. And I think that now people say, oh gosh, I'm so stressed out, I think I'm going to have a stroke. What does that kind of thing mean? Do people really get a stroke from being stressed out, or do they have to have other factors?
Well, probably other factors, but stress can be important in strokes too, and heart attacks. We know that more people tend to have strokes around periods where their blood pressure is high.
Oh, that makes
They're
sense.
under a lot of
Some breaks.
metabolic stress. Also surgical stress. We know that people who undergo surgery have a slight increased risk of stroke because they're inactive. Also, the inflammation going on from the surgical site can lead to increased clotting.
Sure, yeah. So the takeaway from that is to make sure that you have as good of health basically going into things like surgery as possible, so that those naturally occurring, shall we say, risk factors are kind of mitigated too. After a person has a stroke, we've made some strides in rehabilitating them too, right?
Right. The Sutter has a rehabilitation center now.
In Roseville. And it's a 44-bed facility, and they do wonderful things with patients with stroke.
Even some folks that have had really major strokes, I think,
Absolutely,
have
absolutely.
come back considerably.
A little bit.
But really, to go back to the beginning, the key is to not ignore those symptoms and to get in quickly to the emergency room.
Absolutely.
And I noticed when I was there with a friend a couple weeks ago, is there a stroke room that's in the emergency room?
Not
No.
specifically, but what we do have is a stroke gurney, because when we give the clot buster, we need to have an accurate weight. So that's
Oh.
why we have one stroke gurney. So that was good. We want to have an accurate weight, of course.
Okay.
And I just wanted to add the risk factor of atrial fibrillation. And I know that Dr. Van Fossen can speak to that, but that's a really important one, especially in baby boomers, right?
Right, that's very frequent. Needs to be treated. It's a major risk factor for stroke, and it's very treatable.
And for lay people, atrial fibrillation is?
Sort of an fluttering or a irregular beat in the heart, and can get very fast, but it doesn't allow the heart to fill completely with blood, so then it kind of sits there and a little clot can break off.
Can break off.
Right.
And sometimes people don't know they have it because they don't feel it, right?
Right.
Yeah.
Right.
So when you go in for your annual checkup, does the EKG show it, or?
Right, you can even diagnose it just by taking your pulse.
Really?
The doctor can.
The doctor can, yeah. So the important things are to pay attention to what you can do to help yourself. Stop smoking, keep your blood pressure and your blood sugar under control. And of course, we all know how to do that by staying active.
Right.
And then if you have a symptom, and the symptoms are facial droop, arm or limb weakness,
Slurred speech. You can have some visual changes. Dizzy.
If
I
you-
always kid about the dizzy dames we are as we get older.
Yeah.
Yeah.
Well, and see that again, it's like, those are very elusive symptoms, but if you suspect it, you should go to the emergency room because they want you there fast.
Or call 911.
Call 911,
Yes.
yes.
Stroke is an
And get there as
emergency.
quick as possible so that you can get taken care of. Well, thank you both for being here fast today and giving us this important information. And I'll take some magnets to the center.
Okay.
All right, that's all for this week. Next week we'll be back with our final in the sixth series of Today's Seniors Living Well. We hope that some of these puzzling things have been unraveled for you, and we'll see you next Wednesday.
Thanks for watching TSPN's Today's Seniors Living Well with your host, Laurie Webb.